The SPATS 3 adjustable balloon system offers an easily adjustable one-year balloon therapy that provides a safe, customized balloon weight loss system, now easier and faster for endoscopists. The insertion kit contains the device connected to the extension tube, the provided cap, the insertion facilitator, the syringe, patient card, and chart labels. Prior to implantation, a standard endoscopy is performed to evaluate for contraindications. After completing the endoscopy, dry the endoscope thoroughly. Disconnect the extension tube from the valve. Using finger pads only, do not use your nails, roll off all of the bands as shown. With 2 fingers, hold the insertion facilitator and place it on the end of the scope. Do not roll it on. Firmly grab the rolled edge, lift away from the scope, and pull it down the scope. Repeat on the other side until the distal edge of the insertion facilitator reaches the scope tip. Roll it back until it covers the proximal hole. Find the left side of the scope using the up-down dial as shown. Place the distal tip of the balloon just touching the insertion facilitator and roll it over the balloon. The balloon tip should be within millimeters of the proximal hole. Pull the proximal hole over the scope and then the distal hole over the scope. Pull it all back to the balloon tip. Reconnect the extension tube to the valve. Align the soft catheter along the scope shaft. Using thin paper tape, secure the valve to the left side of the scope. Roll the tape diagonally until the valve and the gripping parts of the extension tube are covered. Then double over the end of the tape. Hold the endoscope and device in one hand and generously lubricate the balloon, endoscope, and valve areas as well as inside the mouthguard. Insert the endoscope and device as you would in a normal endoscopy. A snug fit at the mouthguard and the upper sphincter are to be expected. Pass to the distal antrum. Retroflex to confirm presence of the balloon in the stomach. If the balloon fell off in the esophagus, you will need to push it down below the GE junction. Attach the 3-way stopcock to the saline bag and the syringe. Inflate the balloon. We recommend 450 to 550 cc's. Once inflation has concluded, withdraw the endoscope and the extension tube together. As you pull back, you will see the balloon and you will feel pressure as the balloon releases from the insertion facilitator. Continue pulling until the valve exits the mouth. Part of the endoscope remains in the esophagus. Secure the valve while removing the tape. Disconnect the extension tube. Dry the valve and cap well, and tighten the cap in its place. Lower the valve into the back of the throat. It will pull itself back to its position, but may require some scope movement to help. Gently push the cap and catheter below the GE junction. The procedure is now complete.